All right, whenever.
Good evening. My opponent's main claim is that human errors are the #1 cause of foodborne illness. My opponent's secondary claims are that 1, food handlers are improperly trained and are prone to mistakes, and 2, restaurants improperly run the risk of serving foodborne illness dishes. 3, non-professional food handlers increase the speed of possible foodborne illness. I completely dismiss my opponent's claim of fact due to lack of evidence. And also, human errors are not the #1 cause of foodborne illness. It's a bacteria called norovirus that is found in already contaminated food even before it is cooked. And I found that on the CBC Foundation. It's a health foundation. In my opponent's first claim, she tells us why food handlers are prone to mistakes, but does not cite any evidence which leads me to discredit her argument. She states that improperly trained food handlers are prone to mistakes because improper cooking methods are carried out. How so? She does not give any factual examples, nor does she go into detail about why. It is simply the bare minimum, and it does not benefit the argument in doing so. Some of my opponent's evidence is based on value rather than fact. She gives us many examples that evoke disgust out of the audience, but there is no factual data to back up the example. My opponent's reasoning process does not help the audience understand her point. She does not analyze the points, instead she just gives examples, and examples don't help unless they have meaning or relevance to them. There really isn't any reasoning in the argument, there's just uncited statements and examples. If the food handlers are improperly trained, then it is not the fault of the food handler himself, but of the management that poorly taught the employee. My opponent blames the cause of foodborne illness on the worker, but when in reality it is the fault of the upper management who taught or allowed the worker to handle food in such a way. The next point does not even have anything to do with the main claim. Her subpoint is that restaurants run the risk of serving foodborne illness. But how does that relate to the claim that human error is the #1 cause for foodborne illness? In the main claim, she is blaming the food handler, and in her second point, she does not even mention anything to do with human errors. Instead, she talks about the restaurant as a whole, which entirely undermines the argument. Again, her point does not have reasoning. She only makes statements without a credible source, and she does not elaborate on her statements. She tells stories that intrigue the audience, but no facts are presented. This point completely throws off the order of the argument, because now we're not even talking about how human errors cause foodborne illness. Now she's stating the things that lead to food handlers not caring about the quality of the food. In this case, her main claim should be that the overall environment contributes to foodborne illness. My opponent's third point is that non-professionals spread foodborne illness. And she supports this claim by stating that unsanitary stations develop bacteria. But they have no relevance to each other that the audience can directly see, nor does she evaluate on that point. How does the environment relate to the fact that the people themselves are non-professional? Her point is arguing about the intelligence of the food handler, yet she backs this up by saying that their station is filthy. Those two have no direct association that the audience can easily see. And she does not elaborate nor cite any of the facts that could support her claim. There aren't any citations, so I'm not able to see where this information is coming from. The evidence given is unclear and does not support her point. Once again, there is not a reasoning process. She just states facts that do not seem to have source and backs them up with her own experience or story, much less a factual example. I cannot elaborate on my point because I'm not really sure what her point is due to her poorly constructed argument. She tends to stray from her main claim, and it does not provide any factual evidence in her claim of fact argument. My opponent states that the negligence of food safety may cause contamination. However, her point is that non-professionals spread foodborne illness. Her evidence does not back up her main point. Instead, she goes off on a whole different tangent. The point seems to attack the ability of the food handler, and she goes on to say that the food is neglected and that causes contamination. But that does not elaborate on how that increases foodborne illness, which is her main claim. My opponent should not blame the food handler for the #1 cause of foodborne illness. Instead, she should either blame the things that came before. For example, the manager of the guy that handles the food or the factory that actually creates the infected food itself. Thank you.
All right, you start off pretty clearly labeling the main and secondary claims. You've got a general argument that you're going to be making that there's a lack of evidence. And then you do have one piece of evidence on your own that makes a counterclaim. But I tell you what, your counterclaim evidence on this point, it sounds like it's a paraphrase, not a direct quote, and you need to get the source citation a little bit clearer. If it's the CDC, that's fine, but I know what the Center for Disease Control is, but you should have a clear, explicit quote on this that it's related to this bacteria that you're talking about. I was a little surprised, for instance, that there wasn't some general information from your side on this issue. It wouldn't be hard to point out, look, here's how many thousands, millions of people buy food out on a daily basis. And here's the number of people who get a foodborne illness as a result. It's relatively small. And here's the number of people who get those foodborne illnesses who suffer, anything more than a horrible case of, diarrhea or, vomiting. But the number who die, it's even smaller than that. So out of the 50 million people who ate out today, one got sick, that sort of thing. I think you could minimize this claim substantially with some general arguments like that, and that would contrast your argument a little bit more with the absence of evidence that the advocate cites, which is, I think, a perfectly legitimate argument for you to be making, but I'm not sure that the absence of evidence from the advocate abrogates your need to have some information to counter the argument. And it's pretty generic evidence that I think you could find on those particular points. So I think that would have helped make your argument much more effective. I did think you did a good job talking about the absence of evidence in the advocate's claim, although it gets kind of repetitive after a while because it does sound like you're saying the same thing. And the same is true with the reasoning challenges that you're presenting in a couple of places. Like the last minute and a half of the speech basically sounds like it's repeating all of the same issues that you made earlier in the argument, and I think you could probably cut to the chase and just summarize it a little more quickly. I think you're maybe picking nits a little bit on this idea that it's the lack of training that produces these things as opposed to the people in that particular situation. That's a reasonable press to make, but it's the kind of press that I think you could make 5 seconds after they made their argument. It's not something that you needed 2 weeks to get ready to make a response on. So I don't object to your making it. I just think that there ought to be something more substantive there also. Like I said, I think you did a pretty good job indicating where there was an absence of evidence. But if you're going to contrast your position to their position, it would be nice if you had something to contrast it to and say, look, we know that foodborne illnesses, and think about all of the food recalls that have happened recently. Most people get sick. I haven't been paying close attention to it. Did you hear about that thing that's going on in Great Britain? Like, it turns out all the beef in the kids' meals is not beef. It's horse meat and stuff like that. And that's got nothing to do with the food preparers or the servers in the restaurants. That's got to do with the manufacturer. You hear about recalls in the United States of food products or dangerous contaminations that are going on. It's not because some kid working at McDonald's didn't wash his hands after coming out of the bathroom. It's because they got a bad batch of beef from the manufacturer. And there's a lot of incidents like that, I think, that would have made good contrasting arguments there. All right, thank you.